I'm going to be talking about EUROmediCAT's role in optimizing the use of congenital anomaly registries and healthcare databases for medication safety monitoring. I'm going to talk on behalf of Professor Christine Damas-Michel, who's the current president of EUROmediCAT, and Dr. Amanda Neville, who's the current president of Eurocat, and also of a huge network involved in EUROmediCAT of pharmacoepidemiologists and perinatal epidemiologists and pharmacologists and clinicians of various sorts of obstetricians, pediatricians, medical geneticists, etc. And it's important, although I've been asked to talk about the data, the people are as important as the data to ask the right questions in the right way and interpret the data correctly. So it's a network of people as much as it's a network that creates and uses data. So EUROmediCAT can only really be understood in the context of the related networks. It's in a family of networks, and perhaps the parent of that family of networks is Eurocat. So I'll briefly explain to you what Eurocat is. So Eurocat is a European network of population-based registries for the epidemiologic surveillance of congenital anomalies. And that means that every baby born in either a region or the entire country born with a congenital anomaly is registered by that registry. So that makes it a population-based registries. All residents within the region, all mothers resident within the region or within the nation are covered, all babies to mothers of residents. The network started in 1979 and now covers more than 1.7 million births per year in Europe, in 39 active registries in 21 countries, and that's about 29% of the European birth population. The registries are high quality multiple source registries, and there are data quality indicators that you can see on the Eurocat website. Importantly, as well as the births, the live births and stillbirths, the registries also ascertain terminations of pregnancy for fetal anomaly. And that's very important to medication safety monitoring because, as we know, for severe congenital anomalies, a considerable proportion result in termination of pregnancy, and they need to be included in the data. There's a central database of individual anonymized data that's updated annually and is held now at the EU Joint Research Centre in Yspres. And Eurocat is a European reference point for epidemiology, coding, and classification of congenital anomalies. So Eurocat has a number of objectives around providing essential epidemiologic information, infrastructure for research, looking at primary prevention, prenatal screening, clusters, etc. But I just want to draw your attention to the last of this list that you see there, to facilitate the early warning of new teratogenic exposures. Because Eurocat, back in 1979, when it started, and the preceding years of preparation, was really set up in the wake of the thalidomide epidemic. And the idea was to put together a European network that could work on making sure that any new thalidomide would be detected as early as possible. And the initial although Eurocat now has many different objectives, the initial objectives of Eurocat were around that sort of early warning of new teratogenic exposures idea. And indeed, Eurocat now every year does statistical monitoring of congenital anomaly rates under that objective. And you can find the statistical monitoring results on the Eurocat website, as well as the prevalence of about 90 different subgroups of congenital anomaly in live births and stillbirths and terminations in the different participating countries. So turning then to EUROmediCAT. EUROmediCAT is the daughter network that focuses specifically on medication safety in pregnancy. And there's also a central database which includes Eurocat data from 1995 onwards in 21 registries in 14 countries, and that's now a population of 13 million pregnancies that's covered by the registry information. And those registries are Eurocat registries which collect information on medication exposure during pregnancy, which is ATC coded. So the other Eurocat registries that don't collect medication exposure are not included in EUROmediCAT. The cases of congenital anomaly are ICD-10, RCPCH coded and classified into Eurocat subgroups, and the data follow a Eurocat common data model. The central database is at Ulster University and is updated annually. So the strengths of such a large database are that one can look at specific congenital anomalies. There's good diagnostic information. We know that teratogens and medications don't tend to increase the risk of all congenital anomalies, but of specific congenital anomalies, and you can miss that if you pull all the information together. So we're looking at specific congenital anomalies in a very large population, which you need for rare congenital anomalies and rare exposures. And as I said, including terminations of pregnancy. But EUROmediCAT also has a distributed data network. The congenital anomaly registries in a number of the countries can be linked with prescription data locally, and healthcare databases in, at the moment, 7 countries can also be accessed. And also, that means, of course, that one can look also at other pregnancy outcomes, not just congenital anomalies. So here's a map of the various members, the registries and the healthcare databases, just to show it's over Europe. So what can we do with those data? 5 types of studies. We can do case control studies using either the central database or the linked data in the different countries. Signal detection studies. Professor Joan Morris has led a program of work looking at signal detection methodology using the central database. Cohort studies linking the registries to healthcare databases and looking at congenital anomalies and other pregnancy outcomes. And also hybrid studies, which is an exciting new area really of linking either congenital anomaly registries or healthcare databases to primary data collection. And we've done that in connection to a disease cohort study, for example, looking at insulin analogs. And then finally, drug utilization studies using the healthcare databases and examining medication use by pregnant women before, during, and after pregnancy. There's a variety of different types of studies that can be done with that network of data. So EUROmediCAT is the network that I've been talking about. It has a steering group and is the larger network, but for particular studies for the European Medicines Agency research contracts, the EUROmediCAT consortium is the allied consortium that also collaborates with ENTIS, as you just heard Luke Richardson talking about. The Eurolink project is the final one I just want to briefly mention, led by Professor Joan Morris. The aim is to investigate the health and educational outcomes of children with anomalies for the first 10 years of their lives. And that is being conducted in 22 Eurocat registries in 14 European countries. And the relevance to EUROmediCAT and to medication safety monitoring is that this project links the congenital anomaly case data to the mortality and hospital discharge, prescription and educational records, and has developed and validated a common data model to do that, which transforms the key variables to standardized formats. So as you can see, that sort of data, the prescription records, hospital discharge, etc., are the same databases that are used for medication safety studies. And that common data model can now be built upon for EUROmediCAT studies as well as, of course, the conception data model that's being constructed as part of the conception project. So that's a very brief overview of the different networks and where EUROmediCAT fits in and what it does with your medication safety monitoring. I'm happy to answer any questions afterwards. Thank you.